Good morning and thank you for joining us again today. My name is Dr. Wajid Ahmed and I'm the Medical Officer of Health for Windsor and Essex County. Teresa is not here today. I will now report our case counts. We now have a total of 12,009 cases, an increase of 41 cases from yesterday. Of the 41 new cases, 10 are outbreak related, 10 are close contacts of confirmed cases, 7 are community acquired, and 14 are still under investigation. 721 cases are currently active, 10,977 cases have resolved. We now have a total of 311 deaths, an increase of 7 deaths from yesterday. Of these 7 new deaths, 5 are from long-term care home and retirement home, a man in his 60s, a man and a woman in their 80s, 2 women in their 90s. 2 deaths are from the community, 1 woman in her 70s, a man in his 80s. I want to pause for a moment and express my sympathy and condolences to the family who lost their loved ones. We now have 82 cases that are currently hospitalized. 9 of them are in ICU. There are 44 active COVID-19 outbreaks in Windsor-Essex. Out of these 44 outbreaks, 17 are in long-term care home and retirement home, 22 workplaces are currently in outbreak, and 5 hospital units are in outbreak. I'll now move on to present our weekly epi-summary. So starting always from the bigger picture of what's happening around the world, and we can see how the countries are seeing and experiencing the surge in cases of COVID-19 starting from the second wave. The key notable in this graph, as always, is to see the highest increase and then the resulting changes after implementing number of measures that we can see in this graph. As we can see, that Canada, and with respect to some of the other comparator countries presented in this graph, has also seen a spike late December, early January, and then starting to see a decline in the cases. So this is happening pretty much everywhere, and this is what the picture that we are seeing. But compared to the many different countries, Canada still has done a good job in terms of keeping our daily case counts down. Similarly, looking at the number of daily confirmed deaths per million in the world, and as of today, among the comparator countries, UK continues to lead with the highest number of deaths, followed by US, Germany, France, and Canada is still relatively doing better compared to all of these countries. Focusing on the province of Ontario, this is what the picture is. We have seen a huge increase in the number of cases, but with the restrictions, with these lockdown measures, we have started to see a decline in the daily number of cases based on the 7-day average, and seems like we are getting into moving in the right direction, slowly but surely, and we like to see that trend continue. Similar picture in Windsor-Essex, as we can see that the number of cases is starting to decline, and we are continuing to see some cases in the long-term care home community, and overall the graph is moving in the right direction. Looking at the cumulative cases, as we have seen a huge increase in the number of cases with a very steep curve, and now we are starting to notice some early signs of flattening the curve at the top. Similar picture in the cumulative deaths in Windsor-Essex. We continue to see a large number of deaths in the region, and mainly because we know that death is a lagging indicator of all these high increases in the number of cases that we have seen, and we continue to see some of those impacts with the number of deaths in our community. Looking at week-over-week incidence rate per 100,000 population for starting from the week 18th last April and moving in all the way up to the most recent completed week, our case rate is close to 176.5 cases per 100,000 population, and this has dramatically decreased from last week again. And just as a reminder, the week typically ends on Sunday, so next week we will see a further impact of whatever the cases we have seen this week. excuse me, comparing our weekly COVID-19 cases with the Southwestern Ontario region as well as Ontario. We were way above the average for both Ontario and the Southwestern Ontario, but now we're starting to see a decline overall in everywhere, and our Windsor-Essex case counts are now coming closer to the provincial and the Southwestern Ontario average. Looking at our sewage surveillance data for the region, and we continue to see a steady decline, in which for the most part is correlating with our case counts as well, which means basically that's we will expect that the cases will stay at the level with a slight increase, with a slight decrease from where we were before last week, and hopefully that trends will continue as we continue to monitor this. Just as a disclaimer that this particular surveillance wastewater data surveillance method is still under development, and it's being validated through a number of pilot studies conducted in collaboration with university laboratories, municipalities, and the ministries. And as such, these data are considered preliminary and are subject to change. This figure looks at all the tests and unique individuals tested by week in Windsor and Essex, and in total, we have 238,923 tests that were completed as of January 23rd. And again, this is a complete week ending on Sunday. And for the week ending on January 23rd, our percent positivity was 9.3%. Last week, approximately 9,798 tests were completed, which is a slight decrease compared to the early week when we had completed roughly around 11,000 cases, or close to 11,000 cases. This slide looks at the most recent 7 days percent positivity data, and again, this is a preliminary data and is presented for the information purposes. In the past 7 days, our Windsor-Essex percent positivity is 4th highest in the province of Ontario, which is better. We were a 2nd highest, and then we further declined, and our current percent positivity is standing at 6.2%. Looking at our percent positivity data by age group and month, we continue to see a highest percent positivity among the younger age group, and it declines over with the 18 to 34 year age range, and then 65 plus individuals positivity, and then the least positivity is between the ages of 35 to 64. Looking at the daily number of tests by age group in different months, and as we can see, the majority of the tests were conducted between the ages of 35 to 64, and with more people tested under the 0 to 17 age range in the month of December, and that number is declining as we move into the month of January. Looking at the percent positivity data by the forward sortation area in Windsor and Essex region, this is a cumulative percent positivity starting right from the time when the pandemic was declared up to date. Focusing just on what happened between April and January, we saw a different region with a higher or darker shade of the region based on the high percent positivity in that particular region. This happened between April to January, and the most recent between January 19th to January 25th. This is what the percent positivity would look like. As I mentioned, the darker the shade, that means the percent positivity was higher in that particular region. Looking at percentage of test results that is available within 1 to 2 days, and moving on to the 7-day average, approximately 27.5% of tests are being processed with the results available within 1 day of being tested. This continues to be relatively low than where we like to see. Within 2 days of being tested, 81% of tests are being processed with the results available. This has increased from the last week, and we would like to see that trend continuing. When comparing ourselves to other health units region using the 7-day average, we are close to the bottom of our test turnaround time in 1 day. And as we know that we have the lab, Windsor labs setting up to process our specimen locally, and that would help us to improve our test turnaround time. Looking at how long it takes for a result to come back for a person tested in Windsor-Essex, it currently now sits at 1.94 days. This has improved from last week, where it was taking us 2.5 days to receive a test result. Looking at our regional and provincial rates, since the beginning of this pandemic, we are at the second highest rate in Ontario. We have surpassed Toronto, and we have, despite our population size, we are seeing much higher cases than in most areas in the Greater Toronto area. Looking at the rates per 100,000 by municipality, and as on a cumulative basis, what we already know, the highest number of cases based on the rate was seen in the municipality of Leamington and Kingsville, followed by the city of Windsor, and the rest of the municipalities are relatively closer to each other. Looking just from January 1 to present, still the percent positivity, the rate per 100,000 continues to be highest in Leamington and Kingsville, followed by the city of Windsor, and then Essex, and the rest of the municipalities, Tecumseh, Amherstburg, and LaSalle and Lakeshore. So looking at overall distribution of COVID-19 cases by municipalities, the highest number of cases we have seen is from the city of Windsor with 54% of the cases. Well, we already know that city of Windsor kind of roughly have more than half of the population of the region, and so it's no different than what we would expect based on the population size. However, when we are looking at Leamington and Kingsville, they are the second and third highest number of cases in the region, and then followed by the rest of the municipalities with similar numbers. Just in the last 30 days, similar picture with majority of the cases from Windsor, and then followed by Leamington and Kingsville. Just in the last 7 days, a similar picture. Windsor continues to be the highest one, and then followed by Leamington and Kingsville. Looking at age and sex distribution, not much different in terms of any particular trend, especially in the younger age group. We have seen some changes in the younger group coming back positive more. Then that trend is now moving towards more of the elderly people, as we know since the lockdown and since the stay-at-home order, most of these individuals are staying home, so the new cases among that age group is also going down. Looking at the overall epidemiologically linked cases in simpler term, when a case is acquired in the community where there was no known source of exposure. Currently, using a 7-day average, we see that 25% of our cases do not know how they acquired the disease, which is pretty significant still and indicates community spread in the region. Breaking it down by the different type of exposures with all the cases, and as we can see that the red bar indicates the community spread, and we can see that we still, from a proportion perspective, we still see a large number of community spread happening in the region. Breaking the same data acquisition source by each of these municipalities, and this is what the picture currently looks like, with majority of the household cases and the close contacts contributing to the large number of cases. And some of these cases are also linked with the outbreak, which we can see in Leamington and Kingsville, mainly due to the agri-farm sector cases that we have seen in the region. The number of outbreaks, it's also looking to stabilize right now, and with outbreaks rescinding in many of the long-term care home and retirement home, but we are starting to see a trend in the workplaces, and those workplaces outbreak are increasing in the most recent weeks. Looking at the hospitalization and ICU data, and as I presented, the number are decreasing and stabilizing somewhat, which is critical for our hospitals to provide the necessary medical care to the patients, not only for COVID, but also for other medical needs. The number of 14-day average hospitalizations in September, and again, looking at the number of cases that are currently hospitalized. Number of new admission, we've seen a huge increase in late December, early January, and starting to stabilize in the most recent days. With 90% of the cases resolved in the region, we still have a large number of people, roughly 5%, including that are currently in self-isolating, and the number of unknown, 2.2%, we can safely assume that those are all the individuals that are currently self-isolating. And unfortunately, we have lost 2.5% of our cases as a result of COVID. And as we present day-to-day COVID death data, we know that not all the deaths happened just a day before. There may be some deaths that are reported to us late. And this particular graph gives you a picture of the number of deaths reported by day in Windsor-Essex. The age and sex breakdown of COVID-19 deaths, not much different, despite the increase, and the highest number of cases dying were in the age of 80s, followed by the 70s and 60s. So we can see the age is as the most significant predictor of death as a result of COVID-19. Looking at our case fatality rate in Windsor-Essex compared to the rest of the province, and our overall case fatality rate is 2.5%, which is slightly higher than the province of Ontario. And those who are living in the long-term care home and retirement home, case fatality is significantly high within our region, which is currently standing at 11.4%. Revisiting our doubling time, and we see that as a country, province, and locally, we are starting to move in the right direction, and the blue line indicating that we are currently doing better than the provincial and the Canadian doubling time, and we hope that we continue on this trend of doing better, just like we did in September and October time, and bring our case rates down in our community, bring our community transmission down in our community, and are able to safely open up our region. The most recent estimated mean R0 is 0.63, and we continue to see a decrease from before. Last week it was at 0.77, and right now it's at 0.63, which is definitely an improvement. And as we have explained earlier, when the R0 is less than 1, that means each existing infection is causing less than 1 new infection. If it's lower, that means our cases counts are continuing to decline, and we are seeing lower cases in the region, which is also a positive sign to show the impact of everything that happened in the last month with all these lockdown and closures. So in summary, our cases in Windsor-Essex is moving in the right direction, and number are coming close to where we were before, and hopefully if the trend continues, we'll be in a much better position, and we'll move in the right direction to ease off many of these restrictions. However, we still need to recognize that the acquisition sources of at this time is from everywhere, mainly between household contact, close contacts, and outbreaks, but also approximately 25% of the cases are coming from community transmission, and which is something that we still need to contain as a community and follow the public health measures. COVID-19 related hospitalization still is high, but at least it's starting to show some progress in going in the right direction. Number of outbreaks in the region is still high, but we are starting to see that the outbreaks are shifting away from the long-term care home and retirement home, and now to the workplaces that are currently open right now. our day-over-day doubling time is improving, and our R naught is currently as at 0.63, which is indicating a decrease in transmission across the Windsor-Essex, and we hope that the trend will continue. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Yes, good morning. Looking at all of the data from this week, is it rewarding to see the downward trend continue? And at what point do you feel like you'll kind of be able to celebrate these changes?
Well, definitely, it's very rewarding to see that all these measures and all these restrictions, because those are not easy ones, is showing the progress. It's showing the impact of all the public following these measures, and but again, we're still not there yet. We would like to see us getting back to, if you look at the provincial framework, we're still above the red control zone at this time, and we'd like to move in the zone of maybe, ideally we should be in the green, but we know that it will take some time. And I think when we get into the green zone, or at least in the yellow zone, that will be the time to celebrate for me. Until then, I think we'll just have to reinforce that the only way we can get there is to continue to follow the measures. The numbers will not get there automatically. It will be all of us. It will be up to all of us that how we behave and how we follow these measures to get to that position.
Do you have a timeline of when you'd like to see the Windsor stats be in that red control zone?
Well, I think if the trend continues, I hope to see that we before the stay-at-home order, or close to the timeline when the stay-at-home order is lifted, we should have our numbers that would be reassuring for us to say that we have it at least in a reasonable position to maybe start to open up slowly and carefully, to make sure that we balance the health risk versus the economic and social risk that is currently we're experiencing right now.
Okay, thank you.
Any questions from CBC?
Good morning. I just wanted to follow up on the new order that was issued yesterday. The question being, how realistic is that for people who are low income, kind of folks who live in apartments or work multiple jobs? We've been hearing from some of them and some concerns.
Well, of course, that's why it is important that everyone is aware of what kind of supports are out there. There are many supports that are currently available for people who are doing, who don't have an employer offered financial assistance or vacation time. I think there's been lots of conversation and advocacy effort being done to alleviate those concerns. And at the end of the day, I think it is still important that people need to know that this order is for people who are positive or who are confirmed identified as a close contact. So if I can understand the impact from that perspective, and I think that's why it is important that some of these services are available to them, which it is. And people need just to be aware of that and ensure that they're doing their part to contain the spread of the COVID-19.
Okay, thanks. And then just changing gears on you slightly here, following up on some of the conversation the other day, I guess it's our understanding that second doses in care homes were supposed to start on the 28th, and I believe they're starting actually today now. Was there some sort of delay there? Do we have that timeline right? And can you explain why it was perhaps a day later than expected?
No, I think it was when it was mentioned 28th, I think that was an error. It has to be 29th, because when you give dose number 1, you give 28 days after the second dose. So when we started our first dose on January 1st, so after 28 days should be January 29th and not January 28th.
All right, got it. Thank you.
Any questions from Blackburn?
Yes, sorry. On the same lines of Melanie's questions, would you expect by the time that the provincial lockdown lifts on February 9th, that's still a week and a half away, I guess, that we would be within the red or maybe even perhaps the orange on the provincial framework?
I would anticipate that we would be in the red. The province never really gave or presented a parameter to talk about what triggers that that they need to move a region into gray lockdown. When we went into lockdown, our case rates were in excess of 130 or 140 cases per 100,000 population in a week, which I think we won't be in the next couple of weeks if the trend continues. I believe right now we will be in somewhere around between 80 and 90 per 100,000 population per week case rates. That should put us in the red zone if we were to use the provincial framework. But again, all of these things that we have to be very careful and ensuring that the person positivity comes down. Person positivity is at close to 6% or close to 7%. And we'd like to see that coming down to a reasonable number in addition to the decrease in cases. But just looking at the case rates, we would probably be in the red control zone at this time.
Are you concerned that perhaps people would get too excited once the lockdown ends that they would just return back to whatever activities they were doing prior to the lockdown?
I do kind of worry about that, and I really hope that that doesn't happen, because the key is following these measures. We are following these measures. That's why the numbers are down. And we know that when you ease off some of these restrictions, there will be more interaction. There will be more opportunities for people to come together and then spread the disease. So we want to make sure that people understand that part really, really carefully, that even when the restrictions are eased, it doesn't mean that we can go back to what we were doing before in November and December timeline. I think we need to go back with all the tools that we have by following all these public health measures, always maintaining our physical distancing and when limiting our number of close contacts. I think those two messages, until we are living in this pandemic, that will never change. So we'll have to find a way, even when there are no limited restrictions or less restrictions, that how do we achieve those two goals?
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. We see, although percent positivity rates have dropped pretty significantly, that they remain high in the youngest age group. How does that play into future decisions for the return to school dates?
Yeah, that's a good question, and I think what you can see, Taylor, is the number of tests in that age group as well, right? So the whole idea of how many tests you are conducting and then how many people are coming back positive in that age group. So for many, if I have a child who is symptomatic, and then if I have a reason to believe, I'll be more likely inclined to take them for testing, versus someone, a 25-year or 23-year-old individual who maybe even have mild symptoms and don't even feel the need to go for testing. And just the sheer number of tests that will be conducted in that age group versus in the younger age group, that also helps to increase the percent positivity of the test. So when I'm looking at the overall number of tests conducted between the 0 to 17 age group, it's not that high. So I do feel that we have to go back to the risks for each of these individuals, their acquisition of the cases, and in most cases, because if the children are not going to school, their acquisition source would be their family. And if that's the connection that we have, it may not have an impact necessarily on a return to school, but it will have an impact on seeing that how many of these cases are in the community, and should there be any reason to believe that the numbers are significant enough that would pose any risk to the school system. At this point, I don't think that it would factor in, but we will continue to see the person positivity and also the overall cases in that age group.
And separately, I know the health unit doesn't particularly they manage outbreaks at long-term care and retirement homes, but you don't intervene in the necessarily the day-to-day operations of those homes. However, we have seen the province basically reject an offer from the federal government to have military intervention. Do you know how well our local long-term care and retirement homes have been able to handle these outbreaks in the second wave, and if they may have benefited from such an intervention?
Well, I think this is not an easy question to answer, because we can always anticipate that if we do things differently, how would that bring any changes to the system? With the second wave anticipation, and even late in the first wave, the province did put up these long-term care home and retirement home and assign them to work with a hospital partner to support them with their IPAC practices, and also with their staffing needs and any other supports that they need. We have seen that when these long-term care home and retirement home went into outbreak, their staffing support is provided by the hospital. The need for them to have IPAC audits, IPAC practices is supported by both hospitals and the health unit. We have oftentimes have done joint inspections, joint education training for IPAC, PPE use, and all of those measures. So we've done all of that. I think the challenge is still the long-standing issue of how well run these long-term care home and retirement home, or their staffing complements, their staffing challenges, and all of these other challenges. So it's not as simple as bringing in the military, because if you're bringing in the military, yeah, they will provide the manpower or the offering assistance on site, which is also being offered by the hospitals, as we have seen that some of the hospital actually took the leadership role in these facilities to do that. So I think we can always argue that which option could be better, but I just want to make sure that we know that there are a number of steps and there are a number of measures that are also put in place by the province and supported by the local health unit as well as the hospitals to contain these outbreaks.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, just following up on the school question. I know earlier this week you said you were hopeful that in-person learning will return after February 10th. Just look at the calendar. February 10th is a Wednesday. If the province gives the green light for schools to open in person, I guess on the 11th, does that make sense to have them go back on the 11th and 12th when Monday is a holiday with Family Day? Could you make an order saying in-person learning would resume on the following Tuesday?
Well, I think we'll have to look at what's happening, and as I've said and expressed my concerns about the schools, both positive and negative. And the positive part is we do know that these young minds, they need to be in the schools, but they need to be educated. It is important that we recognize that part. And then in order to achieve that, we also want to make sure that the schools are safe environment to go in, and then they are able to study without having to worry necessarily about COVID-19 spread in the school system. I think as a community, when our background case counts are down, and this is what we have said before, if our background community case rates are low, we feel that the schools, when they're following all these public health measures, will be a safe place for people to go and attend school. So I think we still have 2 weeks timeline. I don't know how some of these recommendations from the province will come down in terms of reopening. We do hope that the order or the direction would automatically take that into consideration of what makes sense from an operational perspective, and we will look at it carefully and then make appropriate recommendations either to the province, or it will take some decisions locally.
When it comes to masks for students, where do we stand on that? Is it just grade 1 and above that have to wear masks? If so, could you see kindergarten students wearing masks when or if in-person learning returns?
Well, I think our return to school toolkit, it touches on that. We say that anyone who is able to wear the mask in the school system should wear the mask. And we continue to stand by those recommendations, recognizing that there are some additional recommendation that's coming from the Ministry of Education by mandating mask use in grade 1 and above. It's a challenge, and as we can imagine, like every child is different, especially in the younger age group. Some are able to wear the mask comfortably without any issue, no problem. The others are unable to wear the mask as efficiently and effectively as we like them to do, and then the enforcement is another challenge. So I think we have to take that with a grain of salt, that it may not be as perfect as people want it to be perfect, and as long as rest of the other measures are in place, which is again the background case rates in the community, the appropriate infection prevention and control measures in the school system, strictly enforcing the cohorting principle, and also ensuring adequate physical distancing. All of these measures will be much more important than the mask piece on its own.
Thank you.
Any further questions from CTV?
No, thank you.
CBC?
Hey there, thanks. Doctor, I just wanted to follow up on some questions I think that were asked in previous briefings, and I guess we're still looking to answers to. So one was whether or not we know if any migrant workers who have arrived since January have tested positive.
I don't have that information, and I don't know if I think Teresa did provided some of that information. It's hard for us to break it down to that level of analysis in terms of saying that they actually arrived in Canada. Most of these individuals, when they're coming in and quarantining, they quarantine. And unfortunately, we don't have a system or mechanism to know when they are arrived and when they finish their quarantine. We only know when they're positive. To my knowledge, I don't think that I am aware of any particular individual who just arrived and got positive for COVID during their quarantine period. But that doesn't mean that I'm confident about that. So maybe I'll have to ask that specific question to my team, and I don't think that it was brought to my attention that there was such instance, but I'll double check for you.
Okay, thanks. And is it all right if I fire one more?
Sure, go ahead.
All right, thanks. This is also quite specific. So I understand that the other day Teresa offered some numbers for how many residents and staff and essential caregivers were still waiting for their first shots of the vaccine. She said that there were 400 residents, 1,000 staff, and 700 essential caregivers who were still waiting. We're just trying to figure out the context around that. So can you tell me how many people there are overall? Like what percentage have received their shots? What percentage are still waiting? Do you know that?
Well, I think for the residents, and I mentioned that we have between 80 to 85% of the residents that are already vaccinated, and those who were not vaccinated were because either they had active COVID or their clinical situation didn't allow them to receive the vaccine. So those are the two reasons that basically prevented some of these individuals from getting the vaccine. When it comes to the staff and caregivers, I think that's another issue that we plan to present on Monday. We are doing a lot of the data analysis on that part to to provide you a better picture of what this number looks like based on the reports that we have from the homes in terms of their coverage. There are some data issues that we want to make sure before we report. So Monday, we hope that we will present that breakdown of who received what and what proportion, what vaccine, and all of those related data that should come on Monday. So stay tuned.
Thank you for letting me know. Thanks.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
No, thank you.
AMA 100?
Just got one here. Dr. Ahmed, the month is obviously wrapping up. February 1st is Monday. Just want to get your thoughts on the month of January. Obviously, we started off heavy with case counts, and I believe it's probably one of the deadliest months for our region. But overall, just your thoughts on the month of January, obviously with the numbers going down now, and you always say you're optimistic and you feel hopeful, but just want to get your thoughts on the month.
Yeah, no, we did anticipated that things will be bad in and around Christmas timeline and right after the Christmas timeline. So we kind of anticipated that this would happen. And again, it was no surprise to anyone else. But the way our region progressed to that high rates of cases and the high number of deaths, that's really, we were not anticipating that. So it is unfortunate that we have lost so many lives to COVID in our region in such a short period of time. So that's I think the most hardest part for me to look back and see that why these people died with all these high rates in the community. It's what happens, and it bothers me sometimes when we continue to see people who think, oh, it's just the old people and whether they're truly dying from COVID or not. A death is a death. You have to talk to the families. You have to talk to their loved ones, that how they feel about these deaths. And if these deaths are triggered by having COVID and dying as a result of having contracting COVID, it's sad because we could prevent that from happening by limiting the spread of COVID and in our community. So I think it is unfortunate that we have lost that many lives, but I am hopeful that as we move on to the with the second doses of vaccine in the long-term care home and retirement home, at least we will be protecting our most vulnerable in our community. So that's what positive energy that I am drawing from, that once our homes are vaccinated, we will be in a much better position. We will continue to work with the community. We need their support to keep the case rates down. And once we start to see massive rollout of vaccine in the region, we'll be in a much better position to get back to our life before COVID time.
Thank you. Have a great weekend.
Thank you.
Thank you, everyone.